Hello Achievers, welcome to Team MDS Achievers, myself Dr. Vikram. Today we are here to discuss about the apexogenesis. Coming to the definition, it is a treatment of vital pulp by capping or pulpotomy in order to permit the continued growth of the root and the closure of the open apex. The major important point that you have to remember is that it is in an open apex and the tooth is in a vital stage. These are the main important points. And coming to the rationale, that is like, see, a tooth, this is a normal tooth. This is an open apex tooth. That is like a root formation is not completed. So then what we'll be doing is we will maintain the radicular pulp vitality like that only, so that it will make the growth of the remaining root that has been not formed on its own. This is called as apexogenesis. This is the main rationale of the apexogenesis. Coming to the indications, they are indicated for traumatized or pulpal involved vital permanent teeth. If at all it is a non-vital, it has to go within a root canal therapy. As when root apex is incompletely formed and no history of spontaneous pain. That is like, if at all there is a spontaneous pain, then it should go for the root canal therapy. No sensitivity on percussion, no hemorrhage, and normal radiographic appearance. That is like no damage to the underlying periodontal structures. Coming to the contraindications, the evidence that radicular pulp has undergone, that is like any degenerative changes, then we have to go with an apexification procedures. And if at all there is a purulent drainage, that is like pus formation, that means like radicular pulp is involved. So there, and radicular pulp and underlying surrounding tissues also, that is like our alveolar bone and also cementum, this all structures, the periapical tissues are been involved. So thereafter you have to go within a root canal therapy. That is like our first apexification should be done, and history of prolonged pain and necrotic debris in the canal or periapical radiolucency. That is like any damage to the periapical tissues. Then you have to go. That is like formation of periapical radiolucency means that it will give a diagnosis of either periapical abscess or periapical cyst or periapical lesions. So thereafter you have to go within a root canal therapy. Coming to the procedure, see, the application of rubber dam. First thing is you have to give the local anesthesia. Then you have to place in a rubber dam, removal of all the caries tooth structure and open the pulp chamber and remove the coronal pulp. That is like just as in pulpotomy, you will be removing the coronal pulp. Here you can see the coronal pulp is removed, and then the rinse all the residual debris and control the hemorrhage by placement of the moist cotton pellet over the amputated pulp region. And calcium hydroxide mixture is the material that is used to place over the stumps. Here you can see the calcium hydroxide that is placed over the root stump areas, pulp stumps area, sorry, followed by temporary restorations. That is like, see, this is a radicular pulp. This is a coronal pulp. What we'll be doing is placement of a calcium hydroxide over here. This is calcium hydroxide. Over it, we will be placing the temporary restoration, that is most commonly zinc oxide eugenol or zinc phosphate cements can be placed. And once the root formation is what we will be doing is follow up the radiographs taken periodically to check any of the like root formation has been completed or not. Once the root formation is completed, then we can go with a normal root canal treatment that can be started. This is one of the major important questions that they can ask you, because like they will not ask you directly questions, like they will be asking you in a case scenario questions, that is like a 8-year-old child by name Ramesh has been fallen down and uh, caused any damage to the, that is like a pain has been a damage to the center upper central incisor, that is like central incisor. And The on radiographic evaluation, it was found that no periapical lesions was been seen, and the tooth was in vital stage. What is the treatment that you will indicate? See, at this period of time, the questions are coming from entire subject. Like, see, you are going to study. This question requires a knowledge of the tooth eruption sequences and the root formation and the apexogenesis, apexification, root canal, that is root canal treatment and all. Because a child of 8 years, that means like his central incisors have been erupted 1 year back, that is like in 7 years, and the root formation will be completed from 2.5 years after that crown eruption has occurred. That is like, see, if the tooth has been erupted in a 7 years, that means in a 9.5 years, the root formation will be completed, or 10 years, around 10 years, the root formation will be completed. So you have to understand that is a one of the major concept that you have to remember. So that means the root formation is not completed for this Ramesh patient. That is because he's an 8-year-old child. So what you'll be indicating, it is vital, open apex, and also no periapical lesions. So thereby you're indicating the apexogenesis. If at all it is a non-vital, then you will go with an apexification. That means non-vital is an non-vital open apex is an ideal indication for the apexification. If at all there is a periapical inflammation, then you have to go with an root canal therapy. Okay, thank you.